into the chat function. We encourage you to go ahead and enter your questions right now or throughout the webinar. You don't have to wait until the end of the webinar. We will answer as many questions as we can at the end, and this is also a chance for us to hear your questions about this program, so your questions are very important to us. A brief overview of the agenda. Dr. Wu will outline TennCare's overall opioid strategy. He will also review the buprenorphine MAT program description that each TennCare MCO will use for provider contracting. This is the review of the program description I sent to each person who is registered for the webinar. If you did not receive a copy of the program description, please enter a comment in the chat function with your email address, and I will get a copy to you. We will then hear from each TennCare MCO, Amerigroup, Blue Care, and United Healthcare about their contracting process. With that, I will turn it over to Dr. Wu.
Thanks, Mary, and thank you all for joining today. We are really grateful for your partnership and your support, and we are eager to be able to have a conversation around MAT and opiate use disorder. Just to level set, we know at TennCare we use acronyms left and right, and so just a couple of key ones in case you're not familiar as we talk about them throughout the program today. A few that I'll highlight that we will use multiple times. MCO is our managed care organizations. OUD is opiate use disorder, OBOTs are office-based opioid treatment facilities, and then MAT is medication-assisted treatment. And so, again, those are some acronyms that we'll be using multiple times throughout the presentation, but just to make sure that we're all on the same page. So one of the first things that, just as a high-level overview, to give you some understanding of how we got to this point and why we've convened this group of providers to have a discussion about the program description for MAT. We recognize that the opioid epidemic is certainly something that has hit the nation, and here in Tennessee we're not immune to that, and in many ways we've been disproportionately affected due to our geography here in the state. We have been working and been active in trying to combat the opioid epidemic at TennCare for several years, but really in the face of the continuing negative health outcomes and the negative consequences that we've seen, we want to take a moment to take a step back to really re-examine some of the interconnectedness and the complexity of the epidemic and determine where there may be gaps and for other areas for us to continue to build and push forward on our efforts here at TennCare and across the state of Tennessee to try to impact and provide better care for our members who are chronically using opioids or struggling with opioid use disorder. This graph here shows the increasing rate. While we have had some success in reducing the number of opioid prescriptions, reducing the number of exposure for opioids across the board, we continue to see some of the most worrisome trends continue to go in the wrong direction. Opioid use disorder has continually increased over the last several years. And then secondarily, if you look at it mapped as a heat map, what is overwhelming about this is how much red there is across the state. That no region, no member, no citizen, no Tennessean, no MCO is being left out of this challenge. And in the last 18 months, as we looked at it, there were about 24,000 members, and likely an underrepresentation of how many individuals in Tennessee on TennCare are struggling with opiate use disorder. At the same time, we know that there's an increase of evidence that continues to show the effectiveness of medication-assisted therapy and treatment as a pillar of now what is considered the best practice and evidence-based for treatment of addiction. Certainly we recognize this is just one of many studies that could show some of the benefits of MAT, but it has been shown to decrease opioid use, decrease opioid-related overdose deaths, decrease overdoses related to heroin, which is the graph on the right. It has decreased symptoms of abstinence syndrome, and really has had wide-reaching effects, and we understand and recognize that MAT is an evidence-based treatment for the treatment of addiction, and that it's an area that we can continue to begin to integrate and broaden access for high-quality evidence-based treatment. As part of that strategy, as I mentioned, TennCare has really taken a chance over the last 18 months to imagine and to reimagine the efforts that we've been making around the opioid epidemic. And we really developed a strategy that we've been implementing in stepwise fashions as we've tried to increase our ability to improve the health outcomes and the health journeys of our members who are using opioids. And that really has followed a public health lens, to look at a primary prevention, a secondary prevention, and a tertiary prevention perspective around how to combat and tackle the opioid epidemic in Tennessee. I'll go over these briefly, just mostly as a way to level set and to show our progression in the way we've been thinking about it, hopefully as an insight to our efforts here at TennCare and across the state, and along with Governor Haslam's administration. But from the first perspective, our primary prevention strategy is really to try to highlight and focus on individuals and members who are not chronically using opioids. So these are first-time or opioid-naive members or members that are not chronic users. We understand that the literature and the evidence across the board in the last year, year and a half, is tremendously showing that the increased exposure, both to dosage and length of treatment, have increasing risk of long-term chronic opioid use, as well as the health outcomes that come with long-term chronic opioid use. At the same time, several studies have begun to impact and show that opioids as a pain treatment for acute pain issues and for first-time and non-chronic opioid users may not actually be that efficacious compared to non-opioid analgesics. So together, in TennCare, in January of this past year, instituted new coverage benefit allowances that were trying to reduce the exposure of both dosage and length of treatment of opioids for first-time and chronic users, or non-chronic users. The goal of this effort is to reduce or try to limit the pipeline of individuals that are becoming long-term opioid and chronic opioid users. At the same time, we understand that the chronic opioid user population is a very different population. They already oftentimes have physical and chemical dependence to opioids, and as a result, that group requires a different set of strategies and to broaden some of the efforts and the reaches of what the TennCare benefit allows. And so one of the first efforts in the secondary prevention is for our members who are chronic opioid users to begin to engage with them. Our MCOs have all begun to support increased outreach, increased discussions, increased education, increased both to providers and members who are chronic opioid users to get them connected to health benefits such as a primary care provider, pain management specialist, to members or to providers who are tapering opioids, a supportive treatment such as physical therapy, to really broaden access to other TennCare benefits that might help the chronic opioid users begin to reduce their burden and their dependence on opioids when medically appropriate. Lastly, in the highlighted box, really focuses on tertiary prevention. We understand at this point there is a tremendous amount of members who are struggling or have addiction to opioids, have struggles with chronic opioid misuse, and certainly require a different set of treatment modality. We identified that there is a gap that exists in access to treatment, and our MCOs have been leaders in collaborating together along with TennCare and how to begin to tackle and to build a more robust, comprehensive SUD network, to identify opportunities to engage members, to get them connected to treatment, and that's really what the focus of today is. So that's how we landed at this point to where we're now hosting a webinar in hopes of at least beginning to explain the future direction and really garner support amongst the providers, you all who are delivering high-quality treatment to our members, and to really get you connected to the appropriate levels of resources, the appropriate levels of MCO support, and the appropriate level of medical evidence that will allow for our members to maximize their chance of recovery. As part of this, we'll see here our medium and near-term plan to really develop a high-quality SUD and OUD treatment network. In the near term, which we'll spend time today, is really looking at the MAT program description and quality standards. That's the first step, to identify and highlight key areas where we believe that our members should have access to treatments and services, to identify ways for the MCOs to support providers on the front line providing high-quality treatment, to identify ways to share better data and transparency, and to really allow for conversations around the quality and how to maximize the chances of recovery for our members. Secondarily, by identifying these program standards, it allows our MCOs to have to develop networks that are more robust, to allow a dedicated MAT support service group to allow for individuals to be able to get the services, providers and individuals alike to get the service they need. In the long run, we imagine as we define and we begin to build out the MAT network, it will be even more important to connect MAT providers to the entire spectrum of care so that our members will have a seamless experience in their health journey that includes involvement with a primary care provider, pain management specialist, involves different treatment facilities, in addition to the MAT providers as well. And ultimately, as we begin to think about how we can maximize the value of the dollar we're spending on addiction recovery services, we want to make sure that our providers and are being able to be and the resources that we spend here in the state are really maximized to deliver the best chances of recovery for our members. that's a long-term vision. And I'll go ahead and turn it over to Sarah to dive into the question really is, well, what does this mean for you today as a provider, as an MAT provider? What does this actually do, and how do you participate, and what are the next steps? And I'll have Sarah walk through that, some of the administrative portions of what we're going to talk about today.
Thank you, Dr. Wu. So we've outlined 6 steps that will help the providers get access to the MAT network. So first step is to understand the program description. Mary Shelton sent this out to all individuals that registered today, so you'll receive a preliminary draft. The final versions will be on the MCO's website later on. So the program description in general, and we'll discuss this more in detail, is a guide for the MAT providers to use for the minimum requirements in order to provide care. It will outline things from treatment elements to phases of treatment, and we'll talk about that more in detail. The next step is to identify the potential gaps for areas for increased support from the MCOs. This will take time after you dive into the program description, digest it. You can identify where in your practice do you still have gaps in care and how can the MCO support you. So for example, do you need more support for behavioral health counseling, and how can you reach out to the MCOs to get that? Step number 3 is to obtain a Medicaid ID. So this is extremely essential in order to moving forward with this process, and we'll talk about this later on and how to start that. Step number 4 is to indicate interest into joining the MAT network. The next slide, we're going to talk about the first step you can do to indicate your interest. But in general, you will also be able to reach out to the MCOs in order to do this. Step number 5 is to recontract or to contract as an MAT provider with the MCOs. This will be completed with the MCOs and it'll be at their discretion. And then step number 6, as you all know, will be to continue to provide high-quality MAT care to all TennCare members. Great. So for step number 4, to indicate interest that you want to join the network, we have a link available, and that's that top link in the box that says direct link to provider interest form. If you click that, it will open up a form, and this will explain to you about, in general, by filling out this form doesn't guarantee contracting, but will help us share this information with the MCOs to show that you're interested in starting the process. It's key that you answer this one question that says what type of provider you are. It'll say if you're a clinical provider, if you're an administrator. Depending on what you answer, it will open different pathways of questions. If you do misplace this link, it's also available on our opioid strategy site. Passing it on to Mary. Sorry, Dr. Wu.
So next we'll dive into the actual program description itself to give an outline of what we are talking about in the different components. Let me first, to start that off, say that we recognize that there are different medication modalities within MAT. Today we're focused specifically on buprenorphine. The reason is that we understand that for buprenorphine prescribers, there's a different set of both federal and state regulations that allow you, a provider, to prescribe buprenorphine products. So today we are really going to dive in deeply to the buprenorphine program description. However, naltrexone or injectable is another form that we understand has evidence base and some clinical use cases for as well. There is a naltrexone program description that exists for you as a provider if you are a naltrexone provider, and it is very similar in many of the same program components outside of the specific modality of medication. Thirdly, I'd like to indicate that the program description that we go over today will be the same across all 3 of our managed care organizations. While the managed care organization will ultimately be responsible for the contracting and the discussion with each provider, the program description and the elements contained within will be the same across the board. The MCOs have been tremendous collaborative partners to take feedback from stakeholders, to take feedback from many different individuals, as well as to work together with TennCare. And ultimately, we've based a lot of the conversation and guidelines that we'll go over today on ASAM, SAMHSA, and other and our state of Tennessee OBOT guidelines as part of the national and state landscape that we pulled this from. So with that, I'll dive into some of the benefits around contracting as an MAT provider. And why is this important? Well, I think the reason that, as we identified earlier, that part of the gap in the tertiary prevention strategy for TennCare was to identify more opportunities to increase access for evidence-based high-quality MAT. And recognizing that that was the case, it required some different levels of support. And identifying as an MAT provider allows you to access some of these additional supports, specifically from the MCOs around clinical care and coordination support. Getting connected to behavioral health counselors in your area if you don't have those in your practice, being able to get quality data and education, other types of supports from MCOs was important to be able to focus on a MAT focused provider approach. Secondarily, by having a MAT provider network, TennCare understands and has identified ways to better align with evidence-based practice that we're learning from the literature around the pharmacy benefit. I'll spend some more time talking about some of the changes that will be available to MAT providers who join the network with each of the MCOs, but we do think and recognize that from feedback from providers on the front line as well as reading the literature that some of the pharmacy benefits may be able to be flexed to increase access to our members to receive high-quality MAT treatment. Thirdly, I think as with everything in TennCare, as we begin to think about the value of the services provided, we understand that that has to be partly increased transparency around data, around health outcomes, to look at quality as a key fundamental pillar of any program that we run out, and how we can begin to increase that level of transparency with our providers is an important portion for this conversation with our MAT providers. And lastly, again, understanding that MAT services and have a different level of intensity as well as different level of clinical support that's required. It is important for our MCOs to be able to identify the MAT provider to appropriately align reimbursement for those MAT services, something that our MCOs will address both later and in discussions with each of you all as you all move down the contracting process. In the program description, there are 4 main components or 4 main sections that we'll review individually. There's the treatment elements, treatment protocols and guidelines, the program components, and the quality of care. We'll spend some time diving into each of these, starting with the treatment elements. The treatment elements outline some basic tenets that are a high-level overview across these 3 specific areas. First, provider eligibility. As everyone here on this line that prescribes buprenorphine understands, there are federal requirements around buprenorphine, and so to be able to be a prescriber, you have to both be registered and have a license from the Tennessee Board, as well as have what's commonly called as the XDA waiver. Secondarily, the MAT pharmacy benefit as part of this program. We believe strongly that the buprenorphine naloxone combination is a preferred drug of choice for almost all individuals, and that it should follow the prescribing protocols as outlined in the PBM, which is our pharmacy benefits manager, Magellan. Additionally, we recognize that there's increased support that should occur for MAT providers in relationship and in conversation with the PBM. As a result, as I mentioned, we are making some significant changes to the MAT program for MAT providers that are contracted in the network, and these focus on 3 major areas. The first one is to streamline and to shorten the PA process to make sure that the appropriate clinical information that needs to be required can still be obtained, but to reduce any perceived areas or barriers of access to MAT through the PA process. We understand that oftentimes during early phases of treatment, especially during the induction phase, quick and easy access to appropriate buprenorphine naloxone products are important, and we want to make sure we support increased access when clinically appropriate. As part of that, we will make sure that there's dedicated support from our Magellan Pharmacy Benefits Manager to support the prior authorization process. Thirdly, and maybe most importantly, for MAT providers contracted in the network, they will have access to a broader preferred drug formulary, which will include a buprenorphine naloxone sublingual tablet or generic tablet version, in addition to Bunavail. Bunavail, as many of you all know, is the preferred drug product for buprenorphine naloxone as it stands. And as part of the network, an increased access so that prescribers have an option for what works best for the patient based on the evidence will allow for a second buprenorphine naloxone generic sublingual tablet to be added and prescribed as well. We will continue to use this panel of MAT providers in the future to continue to make sure that the evidence-based practices that are being discovered and produced in the literature will also be translated to our MAT providers. The plan for this as individuals, providers as you being in contract, is to phase these in on a rolling basis with a go-live date by January 1st, 2019. Those are some significant changes on the pharmacy benefit and as part of the MAT provider network. Third, in the MAT treatment elements section discusses the clinical approach. In the clinical approach, some of the general comments that we would make is that all MAT and which modality of MAT is used should be done in a shared decision-making process between the provider and the patient. Additionally, there should be discussions about overdose, about how to prevent overdose, about when and if a patient should discontinue from medication, while ultimately tapering and abstinence for members is an ultimate goal that we would love to support. We also understand the evidence is very clear that there are members who may require lifelong treatment with buprenorphine products or MAT products, and we certainly support that as a decision between the patient and the clinician about what is best for them, best for the member, if a lifelong or even extended periods of treatment are required. Lastly, in the clinical section, we discuss buprenorphine tapering and how that should be avoided in appropriate, and how those termination may or may not occur, and some guidance around that. Lastly, there's some additional wraparound supportive measures that we believe are important for our MAT providers to address, including the risk of neonatal abstinence syndrome, discussions around physical health benefits such as voluntary long-acting reversible contraception, and other expected therapeutic benefits and adverse effects on treatment medication. So the first section really is focused on treatment elements at a high level, describing the requirements as a provider on the state and federal level, some of the pharmacy benefits, as well as the treatment protocols, general approaches that TennCare appreciates. To move more specifically into this actual treatment protocols and guidelines, there are three major phases, as you all know as providers, on the front lines. The induction phase, which is really the upfront initial 12 to 24 hours, first 2 or 3 days that a member begins treatment. Those are sometimes the most difficult times where members experience withdrawal symptoms. The stabilization phase, which oftentimes allows for a clinician to begin to taper drug, the buprenorphine, to the appropriate dosage, which may take several weeks. And the maintenance phase, which is the ongoing phase. For the purposes of the program description, we have divided the maintenance phase into less than 1 year and to greater than 1 year, understanding that maintenance is a long-term continuum that may have different types of elements that are required of it. This is a high-level snapshot and overview of the different protocols required for each of the phases. So in the induction or stabilization phase, the program description outlines weekly office visits for less than 1 year of maintenance every 2 to 4 weeks, and ultimately for maintenance phase for members who are in treatment for greater than 1 year, at least every 2 months. That's for evaluation, continued treatment, continued discussion about the drug therapy. In addition to that, there are some supportive services that we believe are necessary to be included as well. We'd like to make sure that all of our members are offered appropriate counseling. Certainly a member who may choose not to participate in counseling should not be discontinued from treatment, but at the very least, from the very beginning, we see a role and believe that counseling should be supportive and offered, and that counseling at a minimum should occur twice a month in the induction or stabilization phase, at least monthly in maintenance phase for less than 1 year, and at least monthly for greater than 1 year, though we understand that members who are in very stable long-term recovery systems may not benefit from the upfront intense counseling services that might be offered. That again is a discussion that we believe the provider and the patient should have meaningful discussion about how to maximize the long-term recovery for a member struggling with OUD. Thirdly, around drug screens. Drug screens we believe are an important component and pillar of accountability for patients. They should occur at least weekly in the induction or stabilization phase. Observe drug screens at least 8 times annually at random times during the maintenance within the first year, and at least 4 times annually greater than 1 year. And lastly, care coordination services have been an evidence-based treatment to show to really maximize a member's ability to maintain and stay in recovery, and they should occur at least weekly in the induction or stabilization phase, and maybe even more frequently in the upfront time. Monthly is indicated in treatment less than 1 year, and monthly is indicated in treatment greater than 1 year. Overall, care coordination services are an important pillar, and we believe strongly that those services need to be offered in conjunction, and our MCOs, as they contract and identify areas to support, may be able to offer supportive services if your practice does not have those types of services available at this time. But they really should be a key component of all treatment for members, especially in the early phase and throughout their ongoing treatment. For the drug screen protocol, I won't read this to you, but in the program description, it outlines several different components of how and to administer drug screen protocols, which include discussions of random versus observed, when the sample should be collected, how the facility should approach both positive unexpected results as well as positive negative results unexpectedly, and then to really outline some of the discussion around drug screen protocol. We would refer you to the program description to spend more time understanding the drug screen protocol. Thirdly, in the program description, we have the program components. The program components really highlight two, as I mentioned, supportive and wraparound adjunctive services that are valuable, that the evidence is beginning to show really support a successful long-term recovery. I'll spend just a few minutes talking about these at a high level and ask Mary Shelton to dive into them a little bit more deeply to provide the detail. Again, care coordination we believe is really important, and all members should be offered care coordination, whether that is a service that your provider group already employs or supports, or if that's something that you need help with from our MCOs in order to be contracted as a network provider. And additionally, behavioral health is also a very important component to help provide those types of services that will help have a member support their recovery services. I'll have Mary talk a little bit more about each of these components next.
I wanted to highlight this item in the program description and clarify the intent. While counseling is a recommended component of MAT, a member may continue to receive prescribed buprenorphine even if not participating in the counseling. As Dr. Wu has said, TennCare and the MCOs view counseling as an important component within MAT. We also know that each member has their own personal recovery path. For some members, they may reach a point in their recovery when counseling is no longer clinically indicated. With that, while counseling is a recommended component, the member may continue to receive the prescribed buprenorphine even if not participating in counseling. The MCOs also want to be a resource for providers who need to refer their members in MAT to professionals who provide counseling services. Listed here are the phone numbers that providers may contact at the MCOs, and these numbers are also listed in the MAT program description. So if you're a provider of MAT services and you're needing assistance in finding a professional to provide the counseling services, you may call one of these phone numbers depending on which MCO the member is assigned to get additional help with that. To round out the program components, there are sections on patient accountability and supportive activities. I want to highlight the engagement with the Certified Peer Recovery Specialist. That's the last bullet here under supportive activities. So peer recovery specialist services are a covered benefit through TennCare as long as the person has the certification through the Department of Mental Health and Substance Abuse Services. The intent here is to ensure that peer recovery specialist services are available to members who want or would benefit from these services. Each MAT provider does not have to employ a peer recovery specialist, but there needs to be a path for referral to an agency who can provide these services. We've attended several conferences and webinars over the past year on treatment of opioid use disorder, and what we have heard is that the outcomes for MAT engagement are much improved when they are coupled with the peer recovery services. All right, with that, I'll pass it back to Dr. Wu.
Thanks, Mary. Lastly, as I mentioned, a key component and approach that we believe at TennCare is to make sure that our members are receiving the highest quality of care. Many of you are already doing evidence-based practices, and as part of this, we want to discuss how we will approach quality of care and how our MCOs will approach quality of care in the program description. The goal of quality of care is to allow for the MCOs and providers to work collaboratively to review and access the quality of care, and to make sure that the assessment of that allows for the MCO to support any gaps or the provider to address any gaps as we've described thus far. The process of this will involve on-site visits, which will allow for individualized and in-person support from the MCOs, and it will include reviewing of the medical records for adherence to the program standards, understanding the clinical treatment guidelines and protocols being implemented in the office, as well as assessing the member experience so that we can understand and respond to any of the needs of our members as they begin to share them with U.S. providers. The quality of care assessment will be a supportive and collaborative effort that should occur annually and allow for our MCOs to make sure that you have the necessary supports and services, as well as to allow for identification of areas for improvement going forward. Also, as I mentioned, quality of care and review, we want to make sure we can increase education around the data and the health outcomes of our members. It's important for us at TennCare to allow individuals and providers to understand, to have a better understanding of their practice outcomes and patterns. And so as a result, we are looking for opportunities to share increased data for the MAT provider network, focusing on 5 key domains. In each of these domains, we're looking at nationally available measures or claim-based metrics, as well as through some of the quality of care assessments, which may require some medical record reviews at the provider level. And the 5 key domains that we initially want to provide increased transparency around data for your understanding of the outcomes of your patients are, number 1, in length of MAT treatment. The evidence suggests that the longer you are in continuous MAT treatment, the more likely you're to stay in recovery. Second area is around the use of behavioral health services during MAT. The third key area is around urine drug screen frequency, again, speaking to the accountability of the patient. The fourth component is around healthcare utilization patterns, helping providers understand for MAT patients their use of emergency room visits, hospitalizations, and how we can make sure we keep an eye on the long-term and overall health journey of our members, as well as the fifth component around some more red flag areas of concurrent use of benzodiazepines and or opioids while on MAT. We certainly understand in the state buprenorphine prescribing guidelines that benzodiazepines and tapering benzodiazepines as you begin OUD treatment is a key component to any member's recovery, and so those types of scenarios and situations will be accounted for. But again, over time, we want to make sure that our members are being able to have recovery as in many domains as possible in SUD treatment. That concludes the review of the program description, each of those 4 pillars. That was mailed out earlier today. If you haven't received it, we will make sure that anyone that has not received it receives a copy. Again, I'll reiterate that this entire webinar and slide deck will be posted to our TennCare Opioid Strategy website, which we'll make sure we provide the link at the end of the presentation. The next step is around contracting with the managed care organizations. I'll turn over to Mary, who will describe, I'll turn over to Sarah to describe, again, where we are in the different steps of what you should do next as a provider if you are interested in participating in the MAT network.
Thank you, Dr. Wu. So back to our step slide, you can see that we went through step 1 and did an overview of the program description. As we keep saying, make sure to go back and read that program description, really get to know it. But we're going to focus right now on step 3 and step 4. So the first one, step 3 is to obtain a Medicaid ID, which we said is essential in order to move forward with the MAT networking process. So go to the next slide. You can see here, to get a Medicaid ID, the first step is, if you don't already have one, is to go to the website that's listed in the dashed box at the top, and this will help give you all the information on how to actually register online. There's 2 different portals for registering. One is for individual providers, and that links at the bottom of the left-hand side, and then for group providers, and that's at the bottom of the right-hand side. So just so you know, an individual provider would be like Dr. Joe, a sole practitioner, whereas a group provider would be Happy Valley Medical Clinic, which is a group of pediatricians. So depending on how you're registering, make sure to use the correct links. Okay. And then for step 4, which is indicating interest, again, just pulling this back up, please make sure to fill out that provider interest form. Again, it's online. The direct link is right there, but you can also find us on our opioid strategy page, which is where the webinar will also be stored. I'm going to pass it on to Mary to talk about step 5, the contracting and recontracting process.
Thanks, Sarah. So the last step here, or the 5th step, is the contracting and recontracting as a MAT provider with the appropriate MCOs to join the network. As many of you know, TennCare is 100% managed care, meaning TennCare as the state Medicaid agency contracts with 3 managed care organizations, and those are AmeriGroup, Blue Care, and United Healthcare. Each MCO is also responsible for contracting and maintaining their own provider network. Also, each MCO sets their own rates for these services. There is not a TennCare fee schedule for this service. There are 3 components to the provider contracting: the MCO contracting and oversight, the provider completing the CAQH process for provider registration with TennCare, and then the provider ensuring that either them as an individual provider or the agency has the appropriate license. Representatives from each MCO have joined us for this webinar. They will share their contact information for those providers who are interested in contracting for MAT services, as well as giving a brief overview of their contracting process. So bear with us just for a minute, and we're going to bring Melissa Isabel from Blue Care up to speak. Melissa, are you on?
Yes, can you hear me?
I can hear you. Thank you very much.
Hi, I'm Melissa Isbell. I am the Manager of Behavioral Health Network Strategy and Innovation for Blue Care, and I'm just going to give you a quick overview of our process for developing our buprenorphine MAT network. So as you can see, we've got contact information here on the screen. You can email at the MAT referral, cmum@bcbst.com, and copy me on those emails. If you have inquiries, you can also use the MAT referral line that was shown on one of the previous pages. So our approach for the development of this network has basically two phases to it. We're going to roll out a unique coding and reimbursement construct specific to induction and maintenance, and there will be 3 codes identified for the induction and maintenance. So you've got an induction code, we've got a maintenance with counseling code, and a maintenance without counseling code, and hopefully that makes sense in the context of the presentation earlier. But first phase will be more or less a campaign that is targeted specifically at our current in-network prescribers who we have been able to identify and verify as holding the appropriate SAMHSA waiver. Now, I just will say that that is not a perfect list because we did develop that from multiple sources, and some of those sources did not contain unique identifying information such as MPIs. So we've worked it really hard, but we know it's not perfect. Another reason that it might not be perfect is that we also recognize that the demographic info that we have for our in-network prescribers under their primary specialty may not actually align with the demographic information for their MAT practices. So we're aware of that, and that's one of the reasons we would encourage you to go ahead and either go online, complete the provider information form on TennCare's website, or outreach us via the referral line or the email address to make sure that we've got the appropriate demographic information for your MAT practice. It's really important because we're also going to be including, as we contract for the service, which will be done as an amendment by notification, we'll be including an attestation page in that packet that you have to return to us, and that's how we're going to try to make sure that we've got all the right information on file, because we want to be able to direct our members to our providers according to their correct information for their MAT practice. So just keep that in mind. We're interested in hearing from you. We want to make sure that we've got your information on file and that it's up to date so we get the packets out correctly and that we get you loaded correctly in the system. So immediately on the heels of our campaign with our in-network prescribers, we will also be working to prioritize the information that we receive from other interested providers in terms of getting them credentialed and contracted as new prescribers in our network. But we're going to put priority on those that are in areas where we have the greatest access and availability and capacity needs. So we just have to kind of prioritize a little bit in that manner to make sure that we're able to put as many providers in proximity to as many members as possible as we build the network. So a couple of things that you have to make sure you do. Sarah referred to this earlier. You need to make sure you've got an active Medicaid provider ID. You also need to make sure that you have a CAQH credentialing profile, Blue Cross Blue Shield credentials through CAQH for practitioners. So make sure that your credentialing profile is up to date, and also that you have authorized Blue Cross Blue Shield of Tennessee to access that information for purposes of credentialing.
All right, thank you very much, Melissa. Next we have Philip Morrison from AmeriGroup. Philip, are you on the line?
Yep, I'm here.
Thank you so much. Go right ahead.
All right, again, I'm Philip Morrison. I'm the Manager of Provider Relations for Behavioral Health Services here at AmeriGroup. And a lot of the same requirements you heard from Melissa are going to be the same with AmeriGroup as far as the Medicaid ID number, CAQH requirements for credentialing and so forth. We're taking just a little bit different approach. We're going to be out and contracting in 3 different phases. The first phase we've already been out and about and have talked to several providers statewide about joining our network for MAT services. And then in the second phase, we'll be reaching out to the SAMHSA approved list of providers. And then in our third phase, we've also come up with a list of prescribing providers across the state that are both contracted and non-contracted that we will be recruiting in our third phase. As far as any providers interested in joining the network, we are asking that they contact our internal provider relations team, numbers provided on the slide. This way, this will ensure that the calls are documented and they're also forwarded it to the appropriate assigned network manager for each region. Once those calls are forwarded, then each network manager will be reaching out, going out and doing site visits to ensure all program requirements are being met, and also to develop any type of plans for those that may not be able to meet all requirements as set forth in the document. And then after that, we will be finalizing, of course, contract arrangements at that point. So.
All right, thank you very much, Philip. Next up, we have Victoria White from United Healthcare. Victoria, are you on the line?
I am. Good afternoon. This is Victoria White. I'm the Director of Network Management. We have a contact number here if you are interested in joining our MAT network. If you would call the customer service number outlined on this slide, that will start the process. Providers who are new to our network will be asked to complete a request to contract. Once that request is completed, the contracting team would reach out to the provider with a credentialing application. All of our providers, both those who are new to our MAT network and those who are part of our existing network, will receive outreach to review the MAT program description. They'll receive this outreach from the network team. We would like to ensure that there's a clear understanding of the program's expectations, and we want to be available to answer any questions that the provider might have. During this outreach, we will also be gathering some additional information from each of the providers. This information will be reviewed by our clinical team, and it will be specific to the items that are outlined here regarding policies and procedures, staffing, written plans to address specific clinical situations, whether the member is receiving their medication dispensed on site or if they are having their prescription filled at a local pharmacy, and then any written process or plan on how the provider will conduct assessment of the member experience. If you have any questions, please do not hesitate to reach out to my team. We are here to assist you in any way possible, and we look forward to working with many of you.
Great. Thank you all very much. Thank you to Melissa, Philip, and Victoria. And please reach out to them if you have any additional questions. Okay, next up we have next steps and resources. I just wanted to highlight the resources that are located in the program description. If you haven't had a chance to go to either the SAMHSA or the ASAM website, we encourage you to do so. Most of the information we pulled into the program description are found in these resources. And then also the Tennessee non-residential buprenorphine treatment guidelines, we use that as a resource as well. So we're going to leave this page up here for the duration of the webinar, but again, it's the contact information for Blue Care, Amerigroup, and United Healthcare. And to reiterate again, if you're interested in contracting, you need to contact the MCO directly. My contact information is located here. If you have a general question about the MAT program, I'll be happy to get the information back to you. And then also a link to our webpage, the opioid strategy webpage.